Hi, I'm Dr. Jocelyn. Today is our special topic, and I want you to listen to my words carefully because what you are about to hear can genuinely change the way you protect your health after 70. We are going to have one of the most important and potentially life saving conversations about medical tests that are routinely ordered for seniors, but that may actually cause more harm than good. These are tests many doctors insist are standard, yet they are tests you have every right to question before agreeing to them. It is time to bring critical medical truth into the open, the kind of truth the healthcare system rarely explains clearly to older adults. When you understand which medical tests provide real benefit and which ones create unnecessary anxiety, false diagnoses, and dangerous overtreatment, you do more than protect your body. You make informed decisions that can literally extend your quality of life and preserve your independence. Welcome to a space where patient advocacy matters more than rigid protocol and where informed choice replaces blind compliance. Whether you are over 70 yourself or caring for an aging parent or loved one, this information can help you avoid medical interventions that do more harm than good. Here is the uncomfortable reality. Over decades of working with seniors, I have seen that there are several medical tests routinely ordered after age 70 that often lead to overdiagnosis, overtreatment, and serious complications. Yet, most doctors never fully explain the true risks versus benefits to their elderly patients. Every week, I hear the same question. I'm in my 70s and my doctor wants to order multiple tests, including cancer screenings. I've heard some of these tests may not be necessary at my age and could even be harmful. Which ones should I question? What does the evidence really say? This question comes from confused seniors facing aggressive testing plans. It comes from families watching loved ones undergo procedures that feel excessive. And it reflects a growing awareness that more medical intervention is not always better, especially after 70. Stay with me, because by the end, you will have information that can protect you or someone you love from unnecessary medical harm while still maintaining appropriate care. Here is a truth few doctors explain honestly. Medical testing after 70 requires a completely different risk-benefit analysis than testing younger adults. What may save a life at 50 can cause real harm at 75. Yet the medical system often applies the same protocols regardless of age, health, or life expectancy. In geriatric medicine, everything must be individualized. Overall health, realistic lifespan, and quality of life priorities matter more than calendar age. One-size-fits-all testing ignores the reality that aggressive medical intervention often reduces, rather than improves, outcomes in older adults. So we must ask important questions. Which tests are overordered after 70? Why are they risky at this stage of life? What does the evidence actually show? And what should you ask before agreeing to any test? Let's begin with the first and most commonly overused test: PSA screening for prostate cancer in older men. In men over 70, this test causes enormous harm. Major medical authorities advise against routine PSA screening at this age because the harms outweigh the benefits. Prostate cancer in later life usually grows so slowly that most men will live with it, not die from it. But once a PSA rises, a cascade begins. Biopsies lead to infection, bleeding, and pain. Treatments follow, surgery and radiation that often cause permanent incontinence and sexual dysfunction. All of this is done for cancers that would never have caused symptoms during a man's remaining years. Large studies have shown that PSA screening in older men does not extend life, yet it exposes them to very real damage. In other words, men are taking serious risks without gaining survival. The questions you must ask are powerful. Given my age and overall health, what is my realistic life expectancy? Am I more likely to die with this condition or from it? And what are the true harms of the tests and treatments being proposed? These questions are the beginning of taking control of your health after 70. Now let us continue with the next reality many seniors are never told. Medical test to question number 2 is routine colonoscopy after age 75. Colonoscopy is extremely valuable for colon cancer screening in younger adults. It saves lives when used at the right time. But after 75, especially if you have had normal screenings in the past, the balance begins to change. At this stage of life, the risks often outweigh the benefits. In older adults, colonoscopy carries a much higher chance of serious complications. These include perforation, which is a hole in the colon, severe internal bleeding, and dangerous reactions to anesthesia. Studies show that complication rates in people over 75 are 3 to 4 times higher than in younger patients. If a polyp is found, the treatments themselves can carry even more risk. Many major medical organizations now recommend against routine screening colonoscopy in adults over 75 who are at average risk and have had previous normal results. The likelihood of developing a form of colon cancer that would truly affect your remaining lifespan is very low, while the danger from the procedure itself is significantly higher. The questions to ask your doctor are simple and reasonable. Given that I've had normal tests before, what is my real risk of developing colon cancer that would shorten my life? What are the specific complication risks at my age? Are there less invasive options, such as stool based tests, that could be safer? Medical test to question number 3 is routine mammography after age 75. Just like prostate screening in men, breast cancer screening in very elderly women often leads to overdiagnosis and overtreatment of cancers that would never cause harm during the woman's remaining years. Large studies have shown that while mammograms in older women detect more cancers, treating those cancers does not improve survival. Instead, it often leads to surgery, radiation, and chemotherapy that reduce quality of life without extending it. The harms are not only emotional, such as fear and anxiety from false positives, but physical. Treatments for slow growing cancers in elderly women can cause lasting pain, weakness, and complications. In some cases, they may even shorten life rather than extend it. The questions to ask are honest and important. What is my realistic life expectancy based on my overall health? If a slow growing cancer is found, would treatment truly help me live longer, or would it only reduce my comfort and independence? What does the evidence show for women my age? Medical test to question number 4 involves aggressive diabetes screening and very tight blood sugar targets in frail seniors. Managing diabetes is important, but forcing blood sugar into very low ranges in elderly patients often causes more harm than good. Tight control increases the risk of dangerous low blood sugar episodes, known as hypoglycemia. These episodes lead to confusion, falls, hospitalizations, and even death. Multiple studies have shown that aggressive glucose lowering in older adults increases mortality instead of reducing it. Medical organizations now recommend more relaxed targets for seniors with limited life expectancy. For many older adults, an A1C between about 7.5 and 8.5 is safer and more appropriate. Yet many doctors still push elderly patients toward younger adult targets, creating unnecessary danger. The questions to ask are direct. Given my age and health, what blood sugar goals are right for me? What are the risks of low blood sugar with tight control? Would a more relaxed target actually protect me better? These tests and targets are not evil by nature. They are powerful tools when used at the right time. But after 70, the goal of medicine must shift. It must focus less on chasing numbers and more on protecting safety, comfort, and quality of life. This is how real senior health begins. Medical test to question number 5 is routine cancer screening with CT scans and extensive imaging. Many doctors order CT scans, PET scans, and other advanced imaging in older patients simply to check for cancer. These tests expose the body to significant radiation and almost always uncover incidental findings, small abnormalities that are harmless and would never cause problems during the person's remaining life. The problem is not the scan itself. The problem is what happens next. Once something unusual appears on an image, it triggers a cascade. More scans, biopsies, procedures, surgeries, treatments. Each step carries real risk. And in elderly patients, those risks are amplified. Most of these findings are clinically insignificant. They are changes in the body that would never become symptoms. Yet once discovered, they are treated as threats. A study in internal medicine journals found that incidental findings in elderly patients led to complications from follow-up procedures in nearly 1 out of 4 cases, with no improvement in survival. The questions to ask are essential. What specific symptom makes this scan necessary? What is the chance that anything found would actually change my treatment or extend my life? What is the risk of uncovering things that lead to harmful interventions? Let me show you how this plays out in real life. A 78-year-old man came to me after his primary doctor ordered a routine PSA test, despite his age. The result was slightly elevated. That led to a biopsy, which caused a severe infection requiring hospitalization. The biopsy revealed a slow-growing prostate cancer. Another specialist immediately recommended surgery. When I evaluated him, I calculated his realistic life expectancy based on his overall health. It was about 8 to 10 years. The type of cancer he had would likely take 15 to 20 years to cause any problem. If he underwent surgery, he faced near certain incontinence and sexual dysfunction for the rest of his life. If he did nothing, he would almost certainly die of something else long before the cancer became dangerous. He chose active surveillance, meaning no treatment, only monitoring. 5 years later, he is in his 80s, living fully, and the cancer has not progressed. Had he followed the original recommendation, he would have spent his remaining years in diapers with no survival benefit. This story is not rare. I have seen hundreds of seniors harmed by tests and treatments that never should have been ordered. The medical evidence is clear. Most major medical organizations now recommend against routine cancer screening in adults over 75 with limited life expectancy. The harms consistently outweigh the benefits. Testing should be individualized based on overall health and realistic lifespan, not just age on a chart. A strong 75-year-old and a frail 75-year-old are not the same. The real question is not whether we can find disease. The real question is whether finding and treating it will actually improve length or quality of life. For many conditions in older adults, the answer is no. And here is something every senior must understand. You have the right to refuse any test. A doctor's order does not mean you must comply, especially when evidence shows the test may harm more than help. Before agreeing to any medical test after 70, there are 3 questions that protect you. First, what is my realistic life expectancy based on my overall health? If it is less than 10 years, most cancer screenings are unlikely to help. Second, if this test finds something, what will the treatment involve and what are its risks? If the treatment is aggressive and dangerous, the test itself may not be worth it. Third, what does the medical evidence show for people my age with my health profile? Demand evidence, not just routine. These questions shift medicine from automatic protocol to personalized care. They put your priorities at the center where they belong. This is how you move from being a passive patient to becoming an informed protector of your own future. Before we close, I want to speak directly to those of you who are ready to take control of your healthcare decisions but still want to protect your strength, clarity, and vitality as you age. Making informed choices about medical testing is essential. It shields you from unnecessary harm, but it should be paired with something just as important, supporting your body in a natural, gentle way so that you remain strong, independent, and resilient for as long as possible. Avoiding harmful tests does not mean ignoring your health. It means choosing smarter paths. It means nurturing your body instead of constantly placing it under medical stress. That is why I encourage seniors to focus on natural support that maintains circulation, energy, and overall wellness without exposing them to aggressive interventions. For many older adults, something as simple as natural watermelon extract, rich in L-citrulline, can help support healthy blood flow, heart function, and daily energy in a gentle way. It is not about chasing youth. It is about preserving comfort, mobility, and mental clarity. It is about waking up with enough strength to enjoy your day without fear of side effects or complications. And for those who want a more complete approach to healthy aging, there are advanced senior vitality blends that combine multiple natural ingredients to support circulation, stamina, and hormonal balance. Ingredients like herbal extracts for energy, plant compounds for prostate support, and natural elements for cardiovascular health work together to help the body stay balanced. The goal is not to replace medical care. The goal is to reduce the need for constant intervention by keeping the body functioning as smoothly as possible. When your circulation is better, your energy is steadier. When your body feels supported, you are less likely to fall into cycles of testing, diagnosing, and treating problems that never truly needed to be addressed. Quality of life after 70 is not built through endless scans, needles, and procedures. It is built through awareness, confidence, and daily care for your body. You deserve a healthcare experience that respects your age, your goals, and your remaining years. You deserve conversations that include honesty about risk, not just routine. You deserve the right to say, let me think, let me ask, let me decide. Because medicine should serve your life, not control it. Your later years are not a waiting room. They are a chapter meant to be lived with dignity, comfort, and clarity. Every test you accept should have a clear purpose. Every procedure should offer a real chance to improve your life, not just satisfy a protocol. You are allowed to pause. You are allowed to ask. You are allowed to refuse. And when you pair that power with natural daily support, with habits that strengthen rather than weaken, you create a future that is not ruled by fear or dependency. After 70, health is not about chasing every possible disease. It is about protecting what truly matters: your independence, your comfort, your joy, and your time. Make choices that honor your life. Not every test is necessary. Not every diagnosis is destiny. And not every medical path leads to a better tomorrow. The best future is built by informed decisions, gentle support, and the courage to place your quality of life first.